The Holistic Health Community is a group of volunteers working to change the world by providing a local model of free holistic health care that is accessible to all.
We have a vision of holistic health care being available to people throughout the world as a right. And we have a mission of making that happen here, locally in our community.
It doesn't require massive amounts of money. It requires people of goodwill working together. And I think, everyone should take this model and run with it. It should be all over the world.
One day each month, our volunteers come together to offer Community Holistic Healthcare Day.
It's all kinds of healers, is chiropractors and doctors and energy workers and acupuncturists and massage therapists.
And we have people from the community come in who get free sessions.
We have everything from babies and children all the way through moms and dads and grandmas.
The town gives us free use of its community center, and volunteers arrive early to transform the building into a beautiful healing space. We smudge the rooms to clear away any negative energy. And we do a Reiki clearing and blessing. A local florist donates a flower arrangement each month. Our local food co-op prepares a vegetarian meal to nourish our volunteers.
I've got some tomato, brie, and pesto sandwiches.
Come by for a session.
I would love to.
Help yourself.
That's really good.
Delicious.
Once the stations are set up, we have an opening circle for all the volunteers, which fills the building with the frequencies of love and healing.
Close our eyes and take a few deep breaths.
It's an organization of we, of us. We're much greater as a whole than we are individually.
And I hope you have an astonishing and a wonderful healthcare day.
Hi, Tom. How are you? Good, how are you?
Meanwhile, community members are already gathering on the porch, eager to begin.
So as a participant in the program, as soon as you get here, you come and you sign in. People come really early, so it's quite a scene out here. Sometimes we have about 30 people before the doors open at 4 o'clock.
Hi everybody, we're ready to go in. Go ahead.
The first 15 clients are invited into the lounge for a lottery to determine the order in which they can choose their modality, keeping the process fair and non-competitive.
Sandra. 2.
After the lottery, all other clients are processed on a first-come, first-served basis, and everyone is asked to fill out a few intake forms.
Consent forms, there are preference forms for who they'd like to see and what kind of modality they'd like that day.
Number 1 can go up to scheduling.
Clients now proceed to the scheduling desk in order.
And sometimes it's a real negotiation because people want a certain person or a certain modality, and it's like, it's not available. And so what we try to promote is, are you willing to try something you've never had before?
Out of a pool of about 40 practitioner volunteers, an average of 16 offer their services on each healthcare day.
One of the most amazing things is that we offer the widest array of modalities, some of them really esoteric by most standards.
I practice Soma Veda Thai Yoga therapy.
I am a New York State licensed acupuncturist.
I'm a neurofeedback practitioner.
It's emotional freedom techniques or tapping.
I'm a licensed massage therapist.
Clients who arrive later, after the initial rush, are greeted at the welcome desk. After going through check-in, they are asked to fill out the paperwork and note their preferred modalities.
Hi. Hey. There isn't anything in particular that I'm here for. I feel like I don't always know what it is that I need or why it is that I need what I need, but there's always usually a broad scope of things and interesting things that are available.
Come on around here and have a seat in your chair. During a session, the client is hooked up to an EEG, which is just a readout of the electrical activity of the brain. So what I'm going to do is I'm going to attach a couple sensors to your head and ears, and you'll just be listening to music. We're going to get you really comfortable, lay you back.
Great.
And there's little pauses and interruptions in the music that signal to the nervous system that there's been a change, and this is just enough to continuously bring the nervous system back to present.
Raise this leg up again.
My modality is called orthobionomy. It's about mostly listening and modeling back to the person's system where it's at, so the system, their system, can decide what changes to make.
So what brings you here? What would you like me to work on today?
I get a lot of tightness in my shoulders. Oh yeah. I have a very busy and hectic lifestyle through work and all the different things that I do. I'm always on the go. So having a day where I could come and get a massage helps so much.
So start on your belly. What happens is somebody will arrive in the room, they lay down, I can feel sort of their energy opening up, their muscles start kind of melting, and it's really beautiful feeling.
I have never had reflexology before.
So every part of your foot and every part of your hand corresponds to a part on your body.
Oh, wow. To be in a moment of silence, be centered, and then you can feel some sort of energy that just flows. Hi. Hi.
We advocate healthcare that addresses body, mind, emotion, and spirit, and that favors the least invasive modalities whenever possible. We believe that the essential heart of health and healing is love, and that we all have the capacity to heal. We believe that the healer and patient are equal partners in the healing process, and that their interaction is one of deep listening and mutual respect.
How you doing?
It just felt like a really deep and much needed relaxation. More than anything, I felt cared for. And that feels pretty special.
How you doing?
Pretty good. Getting relaxed.
Yeah.
I know that I wouldn't be able to get a massage. Sometimes it's a money issue for people. So having access to quality care is really important.
I began coming here because I had contacted Lyme disease, and there's no way that I could have had the opportunity to get all these different treatments because I was unable to work.
Diane really focused on building my immune system and circulating my blood, and actually as soon as she put the needles in, I could feel my blood moving in my body, and I feel great.
Today I saw Amy and we exchanged energies. I feel like I'm in a different space, elevated and taller and flowing.
As much as Health Day gives our clients, it's just as important to our volunteers.
Our volunteers love coming to our healthcare days because they really get something amazing from the experience.
For me, it's been really important to have a space where the healthcare practitioners come together and consistently support each other to share what we're uniquely doing.
It's certainly very different from when I work alone. Between the clients and all of the practitioners, it's just a whole different level of energy.
I think it's a community of loving kindness and people who are trying to work at another level that addresses a lot of what is not engendered so much in our culture.
There's this collective coherence and compassion and connection and unity that's so beautiful.
It's my favorite night of the month. There's such beautiful energy and such spirit. I'm actually getting teary.
For me, what I love most is I want to give back. I want to reach out. And it's difficult as an individual practitioner to reach out beyond your bubble. So it's a fabulous connection between our goodwill and the people who need it.
Hi, how are you?
I'm good. How are you doing?
I'm doing great, so I'm ready to check out.
Okay, and I'm going to ask you, if you have a donation, we'd love to have it. If you don't worry about it. Okay. Carry the energy forward into the community.
Okay, sounds good.
We think it's important for recipients to make some kind of an exchange so it connects them with the work. So we ask them to give a donation or to pay it forward.
Do something you would not have done before for somebody else or something else. Pick up garbage, take a neighbor shopping, walk somebody's dog.
For me, to bring it forward, one was giving money, and also to find ways to do my own volunteering in the area, which is something I've been contemplating.
After checkout, we ask our clients to fill out an anonymous feedback form that helps us know how we're doing.
The feedback forms are so heartwarming to read. You almost cry. Tell by the smiles on people's faces after their sessions that something good's happening with all of them.
The day ends with a closing circle for volunteers, a chance to connect and share a sense of completion.
Every beginning has an ending. And so we end this healthcare day with so much joy in our hearts. And if there's one word that expresses what you're feeling right now, please bring it into the circle.
Love.
Grace.
Presence.
Healing.
Woohoo!
In addition to Healthcare Day, we encourage clients to play an active role in their own health.
Deep, conscious inhales.
We are whole. It is only our own thinking that makes us not whole.
The Holistic Health Community offers free monthly self-care classes and occasional special classes on weekends.
People can learn techniques for helping themselves.
We have presenters come here and present what they're doing.
We're going to talk about the medical marijuana in New York, how it works, who qualifies.
Amazonian shamans, Akashic Records readers. We offer a lot to the community.
In collaboration with our local film theater collective, we co-sponsor films related to health and well-being. Through our annual volunteer meeting, potlucks, and social events, we encourage our community to contribute ideas and get to know each other.
When people get here into this environment, it's like a family, you know?
Right now I'm recovering from a challenge, and this community for the last 3 weeks has had someone come to my house every day to visit, bring food, go grocery shopping, give me a healing. And it's just one little example of the spirit that emanates this group.
The Holistic Health Community is a 501c3 not-for-profit corporation, so we must have an official board, but we put our own spin on it.
So just a deep breath.
And though we have officers, we take turns running our meetings to make them less hierarchical.
Okay, who would like to chair the meeting this morning?
I'm happy to.
Great.
No one is in charge of our meetings. No one is our leader as such. We all participate equally.
We strive to work by consensus on all major decisions.
I make a motion that we allot $50 for this Thursday's refreshments.
I second.
When we have a disagreement, we go around the circle, giving each person a chance to be heard until we reach consensus, which means we may go around several times.
All in favor? Okay.
Once a month, we also meet as a board, not to do business, but to connect on a whole different level with each other.
The first thing we start with in the council circle is check-in.
It is a time for meditation, personal sharing, visioning, deep listening, and for healing any misunderstandings that may be impeding our ability to work together.
Some of you know I was diagnosed with multiple sclerosis. The side effects from the medications were, in some respects, worse than the MS itself. So I decided to quit the medicine and to go alternative, holistic healing route. What I really want to share is about 4 weeks ago, I started getting feeling back in this hand that was permanently numb.
Each person has an opportunity to share their experiences. We communicate from our hearts in order to create deeper connection.
You know, my son-in-law died about 8 months ago, and suddenly, at 52 to die, it's like it's brought me into the whole experience experience of death in a whole different way.
As we heal ourselves and our relationships with each other, we begin to live by our community's core principles of love, respect, acceptance, and harmony.
Thank you for sharing.
You too.
The practitioners and the session that people get is what they come for. But what they don't realize is this is the playing out of community.
This process, this community, works. And this is the start of something big.
We're really out to save, change, evolve the world that we live in.
The model would be for something like this to exist in every community in America and every community in the world where people had access to health care.
Our work is possible thanks to the generosity of our volunteers and our donors. Join us in transforming society, community by community, making holistic healthcare accessible to all.